Hi guys, today we're going to talk about one of the common devices used in orthodontics, and that is the temporary anchorage device, or also known as TADs in orthodontics. So for those who do not know what TADs are, these are tiny screws, and usually they're made of titanium, and these are inserted by your orthodontist into the bone, or particularly the jawbone. So these tiny screws serves as a temporary strong anchor point instead of using the other teeth to move or to pull the teeth into place, which sometimes can cause unwanted movements. The TADS provides a fixed spot to help control the movement of the teeth and to make it more precise. Personally, I would think that the TADS look kind of weird because actually I have two of them and I've been wearing them for more than a year now. So if you're curious about my take of having these TADs, then keep watching this video until the end because I'm gonna share something about the experience of having them. Alright, so let's start off by answering the question, are TADs necessary? The answer to that is they are not always necessary, but sometimes they are very helpful. So TADs aren't usually needed for every orthodontic treatment, and usually they are being used when those traditional methods such as the braces, the elastics, or even the headgear don't provide that control. They can provide a more faster, efficient, and precise movement of the teeth, especially when the case is a bit difficult to navigate or not the usual orthodontic cases. So for straightforward cases, TADs are usually unnecessary. So if your case is not that difficult or it's not that complicated, then you don't have to opt to TADs. And also, having TADs, it's not your decision to have them. It's actually your orthodontist who will assess if you need them or not. Moving on to our second point is TADs provide absolute anchorage. Normal teeth move slightly under orthodontic pressure, but TADs don't because they are anchored into the jawbone of the patient. This absolute anchorage allows the orthodontist to move the teeth without having the fear of moving or shifting the other remaining teeth into unwanted positions or directions. So this level of control can significantly improve the outcome of the treatment, especially if the case is a bit difficult or complicated. So in terms of providing an absolute anchorage, the TADs can do that job well. So for the third point, I'm going to share with you some of the reasons why it is recommended to have the TADs. For the common reasons, I listed 5 of them, and the first one is closing large gaps. TADs are super important and helpful in closing large gaps, especially when you just had your teeth or tooth extractions. So for example, if you had a premolar extraction, just like what happened to me, my orthodontist recommended to have these tiny screws. And right now I have 2 of them at the top jaw. And I would say it's effective in trying to move the teeth without having other teeth to accidentally shift in a different direction. Second common reason is pulling down an impacted teeth or tooth. So there are cases where I know it's kind of common, and I've seen this in different videos about teeth and braces. They have this canine which is hidden underneath or just under the gum of the patient. The TADS does a great job in pulling down the teeth, going down and to be aligned with the other teeth, and so to have a good result of their treatment. For the third common reason of having the TADs is fixing an open bite or deep bites. So these cases, it's kind of difficult to handle it with the normal or usual braces. So the TADs can provide a huge help in improving the bite of the patient. Moving on to another common reason of having these TADs is intruding or extruding the teeth. So the TADs can help in pushing the teeth towards into the gums, which is the intrusion, or the process of moving the teeth out, which is extrusion, to correct the bite of the patient. The last and definitely not the least, and one of the common reasons why patients should have TADs is to prevent the molars from shifting or drifting. In my case, this is one of the reasons why I have TADs aside from the extractions that I had. Because my orthodontist at that time noticed the molar at the back suddenly shifted or like drifted from its alignment. So she decided to just have TADs included into my treatment. And I think it is one of the good decisions that my orthodontist had until I mean, during that time until now, because it really improved, and I think it made my treatment faster. Although I know my whole treatment is a kind of slow, but I know that it really contributed into the movement and to the pace of my treatment. All right, so those are just one of the common reasons why TADs are recommended to be included in your treatment. So going back, we're going to talk about the TADs again. And for that fourth point we have is TADs can help avoid extractions or surgeries. Some bite problems would traditionally require tooth extractions to create some space and help the teeth to move. And worst cases, there are also times that the patient has to undergo a jaw surgery, which is kind of aggressive, and we this is something that we tend to not go into. So the tags can somehow, I think, significantly help you avoid those routes. The tags can provide a necessary force and direction to move the teeth safely and predictably, and to avoid any extractions that might be needed in your treatment. And also, this is to avoid any surgical risks. So the TADs can help prevent those extractions and jaw surgery. Moving on to the fifth point about TADs is TADs are temporary and minimally invasive. For the fifth point, I'm going to talk about my personal experience of the TADs being temporary and minimally invasive. So in the installation of TADs, it's not the way that you might think that it's painful, because it is inserted with a anesthesia. During the procedure, you will feel a bit of a slight pressure whenever your orthodontist will screw in the TADs into your jawbone. But in the overall process, I didn't feel any pain at all. So after the procedure, you can just go on and continue with your daily activities. So it's not invasive as you think. And after that, the TADs will just have to be removed once your treatment is done, or once your orthodontist assesses that you don't have or you don't need to have those TADs anymore. And again, for my case, in the removing of the TAD, also experienced that because my TADs got loosened. I've had another installation. I think that was twice, because I had them have to move into a different place, and still it's not that painful at all. So there's nothing to worry about when you are about to get your TADs. Next is we're going to talk about the cost of the TADs. So I'm not gonna say how much the TADs is, but usually it runs around a few $100s added to your whole treatment. And I know it's a bit expensive when you have TADs. And also, the number of TADs will also depend on your case. So if you have four tooth extractions, then you might need to have four TADs. But your orthodontist would likely offer you some, like maybe two TADs for now, which will be attached to your either your lower or your upper jaw. And then later on, when that gap's close, then you have to move on and move the TADs into your lower jaw, which, by the way, is my case. So I only have two TADs because I can't afford the other two. So I only have two of them here at the upper jaw. And later on, maybe if I have to, then maybe move it here at the lower jaw. But I think in my case, it's not gonna happen because my gaps now are slowly closing, and I think it's more difficult, or I think the TADs are more important here at the upper jaw. And last but not the least is, of course, you have to discuss with your orthodontist if you really need TADs or not. Again, not all cases are the same. So, for example, if you knew someone who had TADs and you also wanted to have TADs, so you just have to ask your orthodontist if you indeed need the TADs, because you have to ask them what are the risks involved, what the alternatives might be, and how long will it take for your treatment with or without the TADs. you have to have a list of questions for your orthodontist about the TADs. So before you decide or agree to have TADs in your treatment, you have to know facts first so that you'll be able to decide on a proper way on how to address any issues with your teeth and with your braces. Alright guys, I hope you find this video helpful and hopefully I was able to answer some of your questions about TADs. But before I end this video, I would like to share to you if whether I recommend TADs or not. I would say if your orthodontist would recommend them based on their assessment, because we trust our orthodontist, then before you agree to them, you ask some few of the questions why you needed them. And once you already understood what's the purpose of having those stats, then I would recommend that you have them. Because in my case, it really improved my teeth. And somehow I would say that it made the pace of my treatment a little bit faster. Because I can't imagine if I don't have the TADs, maybe my teeth will not have to move in 1 year. Because as you know, I'm already in my second treatment of having these braces, and I think to I'm going for 3 years already. But I really noticed and observed that the TADs really helped in my overall treatment. So I would highly recommend, if your ortho says that you need TADs, then you might really need to have them. Alright guys, if you find this video helpful, please don't forget to like the video. And if you're new to this channel, don't forget to subscribe because I also upload my monthly braces updates every end of the month. So if you want to track my journey with my braces, then you might like to subscribe to the channel. And yeah, thank you so much and I'll see you on my next videos.